Years ago, the WRJ came out with this sort of slogan, like no wrong door, meaning there's, any door you walked into in the system, there's integrated services, and it would decrease barriers to help people get access to the medical services that they required. And that's all fine and dandy for the people that can actually get to the door, know where the door isn't locked when they arrived. What about the people that can't do that? So meeting the moment to me is like a no door, no problem situation.
In Canada, we're supposed to be able to access universal health care, which to me means equitable health care. And the reality is not equity. The reality is absolute discrimination, and the youth that we serve, the most vulnerable in our community, don't even feel that they have the opportunity to be treated in an equitable, safe way and have true access to health care. So meeting the moment offers them something that they wouldn't be afforded otherwise.
Meeting the Moment is a Health Canada funded project through the Substance Use and Addictions Program, and it's a partnership with 9 Circles, and it integrates street health, addictions medicine, and primary care interventions. Meeting the Moment provides acute episodic care outside of traditional healthcare settings. We offer a wide variety of interventions. Some examples are STTBI testing and treatment, vaccination, wound care, addictions medicine, harm reduction supply distribution, advocacy, mental health support, and other referrals. We focus on building relationships with individuals who are unsheltered, who use drugs, and experience social exclusion. Peer support workers are involved in the design and delivery of all services. Our cultural support worker provides culturally relevant care and traditional medicines. By partnering with established community resources, we offer weekly pop-up clinics and outreach to encampments. This increases accessibility and acceptability of the service provision. We support system navigation through referrals to other trusted healthcare professionals and agencies, aiming to reduce barriers along the way. We liaise with established professional supports and public health for continuity of care. As we come to the end of our pilot project, we are looking to adopt sustainable and adaptive funding models to continue this work.
The idea behind the project is to be able to create opportunities for people who don't normally connect to healthcare settings like 9 Circles, going into their environments rather than expecting them to come to us.
Everybody needs healthcare, and in this world today, that's not how it's going. We're on their level and they know that. We treat them that way and they feel that way. There's no arguments, there's nothing but laughter with us.
I think it's really important that they have a familiar face and somebody who's, again, in their environment shows that, again, they're an important individual and, we care about their well-being, so we show it through our actions.
When there's a peer involved, it's more of a familiar type face, somebody that they can come to and relate to and maybe feel a little bit more comfortable with.
Unlike any other healthcare setting, we actually go to the people and meet the people where they're at. There's no stigma, we don't judge the people. They feel comfortable coming to us.
I wanted to approach them just coming from the understanding base of being an addict and being approached how I wanted to be approached when I needed help.
We're making that house call or making the decision to go out where people are and meeting them in their moment.
Your team has recognized the need for relationship. That's key to everything, trust and relationship.
I don't think it's surprising that community healthcare, as in actually the community, not a community clinic, bringing care to people is effective. Ultimately, at the end of the day, I believe people want to invest in their health, and when they do not, it's because there's too many barriers to it.
They're afraid, right? They've been treated wrongly at other places, at hospitals. When you tell them to seek medical attention, they're not wanting to. And since you guys came in, I've had people say, this is an excellent service. We're getting our needs met, things that normally they wouldn't do on their own unless I actually took them there.
This is actually really personal for me because an uncle of mine was unsheltered and had to wait 20 hours in an emergency room and passed away the next week. So if there was more of these type of services where it meets people where they're at to meet their own needs, that would save so many lives.
I think it's like soul crushing to start an intervention, to see how effective it is, to hear from our clients, our patients, our stakeholders that this is working, that we've taken the steps to bridge the gap between what was ever thought possible, for funding to be pulled away and nothing to be replaced.
Where are our youth going to go? What's going to happen to them? I lay awake at night thinking about that. It weighs heavily on my mind, and I often reflect back on Joyce Echaquan and what happened to her and her entire family in a place, a hospital, that should have been able to offer her real quality health care, and in fact took her life.
Well, I would definitely support this project moving forward if there was an opportunity for it, which obviously we proved that there is a need for this type of service within not only the shelter system, but within a broader scope of support services within Winnipeg.